Thank you for your question. Absolutely. So CPAP and BiPAP are commonly confused. They both look very similar. It's a patient wearing a tight-fitting mask connected to a box that's doing something involving pressure. So the difference between them is CPAP is continuous positive airway pressure, and it is generally good for type 1 respiratory failure. I'll explain why. And BiPAP is bi-level positive airway pressure, and it's generally good for type 2. So what's going on? If you take a balloon, just a normal balloon, and let it exhale completely, the balloon tends to flop shut. Your alveolus is the same. Because of the elastic tension in the wall, they often collapse if they're allowed to fully deflate. If, however, you pinch the balloon off just before it finishes deflated, it's got some positive pressure inside it which will hold it open. This alveolus is exactly the same. If you have some gentle continuous pressure during inhalation and exhalation, you hold that alveolus open and you provide more opportunity for oxygen to dissolve across from the alveolus into the blood. That continuous positive airway pressure just holds the alveolus open, is good for type 1 respiratory failure because it improves your oxygenation. You still have to breathe for yourself. You are still making respiratory effort and drawing the air in and out. All that the pump is doing, or the ventilator is doing, is holding that airway open for you just to stop that collapse and to improve your oxygenation. Okay, it's the same thing as PEEP on a ventilator, positive end expiratory pressure. It does the same thing, it just holds your alveoli open. BiPAP, however, is bi-level positive airway pressure, which means it has two settings. It's got an expiratory and an inspiratory setting. The expiratory setting is exactly the same as CPAP. All it's doing is holding that airway open at the end of your breath during expiration. That is your EPAP, your expiratory pressure. However, BiPAP also has an inspiratory pressure, or a driving pressure. And what this does is push air into the alveolus to expand the lungs and essentially ventilate the patient as well. So it's got that ventilating, driving pressure during inspiration. And then as you exhale, it does the same as CPAP, and it gives you a little bit of pressure to hold the alveolar open. So you can see the difference here is BiPAP is actually ventilating the patient. It drives air in and then it releases the pressure, but not all the way to zero. It holds a little bit just to stop those airway collapsing. So BiPAP is the same as non-invasive. There's no tube in the patient's trachea. It's a face mask, so it's non-invasive ventilation. Whereas CPAP is just positive end expiratory, or positive airway pressure. It's not ventilating the patient. It's not doing any of the work of breathing for them. It's just helping hold their airway open. The one thing to add is that CPAP is what's used for sleep apnea. So when patients have their sleep apnea machine at home, that's CPAP, and that's slightly different. All it's doing is this process of holding the airways open, but it's doing that in the soft tissues of the mouth and the pharynx, which are what close and obstruct during sleep apnea. So hopefully that clears things up a bit. So CPAP is not ventilating a patient. It's just providing a bit of extra pressure to keep the alveolus open and improve oxygenation. BiPAP actively ventilates the patient as well as doing what CPAP does, and that helps clear out the CO2 because it's actually providing some ventilatory support.